Assalamualaikum guys, this is Dr. Fatima and today we are going to discuss another very important topic, which is transmission of coronavirus and prevention of coronavirus. So basically most of us know that how COVID-19 is transmitted from one person to the other, but most of us also don't know the many ways how it is transmitted, because most of us know, that the COVID-19 is transmitted from the respiratory droplets, but still this is not the only way that COVID-19 is being transmitted. There are other ways as well. Other thing, we are going to discuss the prevention, how we can prevent COVID-19 to be transmitted to us and to others. So let's discuss it. Goals will be modes of transmission, body fluids, which body fluids contain COVID-19 other than respiratory droplets, of course, and if a body fluid contains COVID-19, is it transmissible or is it going to infect the other person? So this particular thing we are going to discuss today. Other thing will be duration of the stay, which means that COVID-19 is staying on different surfaces, for example on the marble, on the floor, on the sheets, on furniture. So we have to see that COVID-19 is staying in different surfaces for how long, so that we can prevent and we can clean those surfaces for that particular time. The last thing is, of course, precautions, that how can we prevent COVID-19. So starting with modes of transmission. Modes of transmission, I have discussed this particular slide and this particular thing in the previous video, which is an overview of COVID-19. You can see it on the channel. Something is new in this very slide, and they are types of droplets, as well as studies have been changed and they are evolving each and every day regarding COVID-19. So modes of transmission for COVID-19, top of the list is respiratory droplets. Now what do I mean by respiratory droplets? Basically, respiratory droplets are the droplets which come from your airway, which come from your respiratory tract, and they should be greater than 5 to 10 micrometer in diameter, and basically they are the major big particles, and they can travel in the air for up to 1 meter. So one has to keep a distance of at least 1 meter, and some studies also say that they can even travel up to 1.5 meter a distance in the air. So a safe distance for social distancing should be greater than or equal to 2 meters. Contact, the other mode of transmission, is contact, direct contact with the surfaces, direct contact with the fomites. So for example, if I have got COVID-19 and I am touching my laptop, I am touching any other surface, I am touching my my phone, anything, I am going to transmit this when some other person is going to touch those surfaces which I have already touched, because it is going to stay on my laptop, it is going to stay on my phone, it is going to stay on everywhere in my surroundings, wherever I have touched. So it's going to spread like this. Third is aerosol. What is aerosol? They are also the respiratory droplets, but they are smaller particles as compared to respiratory droplets. So we call them droplet nuclei in science, because they have got a diameter of less than 5 micron or micrometer. They can travel up to even greater than 1 meter, because they are small and they are shed, they can travel greater than 1 meter, which can be greater than 1.5 meter as well in some studies. So again, the safe social distance is around 2 meters. Okay, and they are going to they are going to be in the air in the aerosol generating conditions. For example, if you are going to intubate a patient, and if you are going to pass an NG tube, if you are going to do an endoscopy or fiber optic bronchoscopy, anything, these are the aerosol generating procedures. An interesting thing about aerosol generating, droplet nuclei generating procedures or part is our usual daily conversation. This was very, very interesting and very lethal as well. that in our usual daily conversation we can also transmit this particular virus to the others. So it's really lethal. The other thing is fecal-oral route, which I have discussed in the overview video, that if a person, because this virus is shed into the stool, and if the person is not maintaining hand hygiene, he can transmit the virus to the bathroom surfaces, and the other person who is going to use that surface, he is going to be infected by COVID-19. Next thing is body fluids and coronavirus. I mean, which body fluids contain COVID-19, which body fluids contain coronavirus, and which body fluids can transmit the coronavirus. Okay, so basically, respiratory droplets are the paramount. They are most important ones, and studies have confirmed their presence, the COVID-19 presence in the droplets of respiratory tract, and they are the potential source of transmission. The other thing, as we already know, fecal matter. Yes, fecal matter is the transmission route for COVID-19. Tears, the new thing which has been recently discovered, that is tears. The COVID-19 is also present in the tears. Some of the patients have got conjunctivitis, which is associated with COVID-19, but we really don't know that if these tears, if there is some contact with these tears, a patient is going to be infected or not. But a few studies, a few case reports say that yes, they are transmissible, they can be infectious. Other thing is blood, seminal fluid, breast milk, urine, vomitus, peritoneal fluid, and vertical transmission from mother to the fetus. We do not have a data that they are infectious or not. We do not know yet, but in the coming future, yes, we can have studies and we can know that these potential body fluids, they can also transmit the infection. So in this particular area, I would like to say that peritoneal fluid, for example, a surgeon is doing surgery, open abdominal laparotomy, then he can be infected. So surgeons are equally at risk as important as anesthesiologists. Duration of stay on different media. So lethal duration for different media, I have just segregated three things. Droplets in the air, they can in the whole period of infection. I mean, for example, if a patient is even not symptomatic, but he is carrying coronavirus in his body, he can transmit it. So it's the potential. It has got potentially high time. What can I say? Its lethal duration is longer, from a window period till the coalescence period. What is window period? What is coalescence period? You can see that in the in the previous video, which was about diagnosis of COVID-19 and laboratory tests. Aerosol, which is air, I mean, the COVID-19, the coronavirus can stay in air for up to 3 hours, and at times it can even travel a distance of 25 feet per second. So it's really lethal. If a person is sneezing or coughing, the droplets are going to be just bombarding the air. Then we have fomites, I mean aluminium, latex, copper. In these particular fomites, the COVID-19 is going to stay for 8 hours. On the cardboards, it's going to stay for 24 hours. On plastic and steel, it's going to stay for up to 1 to 3 days. This is a really pretty good time. Rest is wood, I mean furnitures, ceramics, the bathroom furniture, or and the glass. It can stay for 5 whole days. So you have to clean these surfaces frequently. Precautions now. So important thing in this particular video is that it is not only for doctors, it is also for the whole public. Okay, so we have to keep a social distancing of at least 2 meters. If a person is coughing, sneezing, so droplets can travel for up to 1 to 1.5 meters. So safe distance is 2 meters, and droplet nuclei, they can also travel up to 1 meter. So a safe distance is going to be 2 meters. Then one has to stay home, because we have all seen that during Ramadan and during the Eid days, we have seen a lot of traffic and a lot of population on the roads. This was a very bad experience. I have seen that the doctors are in trouble. They are staying away from home just to take care of patients who have got COVID-19, and the public is on the roads just for the sake of enjoyment and shopping. So one has to stay home. This is a paramount. Please stay home. I cannot stress on it anymore, but one has to stay home. One has to keep a social distancing. Soap can kill coronavirus. One has to, wash hands repeatedly for 20 seconds at least with soap. Wear mask every time, because as I described in the previous slides, that it is being transmitted via normal conversation. So one has to wear a surgical mask at least every time. In the previous video about the mask, I said that you don't need a mask wearing all the time, but now I say that one has to wear a surgical mask every time, खास तौर पे उस वक्त जब when you are in contact with some other person at your home or somewhere in your office, anywhere. Do not shake hands, or it's not necessary, please. Okay, greet one another with social distancing, and do not crowd the spaces, please. Okay, how can we clean the furniture? How can we clean our home? An important thing again, we have discussed that this is going to stay on different floors and different furniture, glass, ceramics floor for a certain amount of period. Now, how can we clean these purposes? This is for general public as well as doctors. Use any household cleaning agent in a form of spray or wipe, whatever you like and whatever you feel at ease. And if the surfaces are dirty, you have to clean them first with the soap or water or surf, and then you have to disinfect them with the spray. And how can you disinfect them? You can make your disinfectant at home. And how can you make a disinfectant at home? You have to take bleach solution that will be good for up to 24 hours for one surface. Okay, what you have to do, basically you have to take 5 tablespoons of a household bleach per gallon of water, and or 4 tablespoons per quart of water. So this is the ratio. You can take this ratio of bleach, and then you have to spray it on the different surfaces. Keep it for 1 hour, let it dry, and your surfaces are done. Okay, never mix any bleaching agent with ammonia or another cleanser. Please, no, don't mix the alcohol based solutions with this bleaching agent. Okay, and the other cleaner is 70% alcohol. You can use 70% alcohol based solutions on the surfaces and keep them on the surface for at least 1 minute, and you're done. Okay, now you have to keep the surfaces clean. If there is any soiling, any contamination, just clean it again. Okay, wash the fruits and vegetables under running water before you eat them. Separate the cutting boards and meat boards. For meat and for vegetables and fruits, you have to keep 2 different cutting boards. Okay, don't mix them up. The other thing is, wash dirty and relatively clean clothes separately. If you are a doctor, you are going to the hospital daily, please keep your hospital clothes separately. Keep them in the air. Keep them somewhere where there is no contamination with the other clothes or other environment. Keep them for 24 hours and then wash them separately from the other clothes. And then we have, don't shake clothes to spread up for drying. We usually do it in Pakistan. We squeeze them and then we just shake them in the air. What is going to happen if there is any COVID-19 on the cloth? It's going to shed in the air and it is going to stay for 3 hours. So don't do it. Okay, what if somebody in home has got COVID-19? How can we take precautions? Continue to practice everyday preventive actions as usual, as I have mentioned before, that clean your hands with the soap and water for 20 seconds, wear the face mask, clean your surfaces, etc. Keep the ill person in a separate room from others in the household. Keep his utensils or her utensils separately. You can use the disposable stuff. Use the dustbin in his own room, and do not mix the garbage with the household garbage. Okay, if caring for a sick household member, monitor your own health too, because you can get sick too. And if you are going to get sick, you cannot take care of your loved one. So monitor your own health as well. Keep the surfaces disinfected and also avoid sharing personal items. For example, nail cutter, combs, brush, anything. You don't have to share anything. Okay. If you become sick, stay in contact with others by phone or email. For example, if a person is isolated at home and he's getting bored, he can do anything. He can see seasons on YouTube, on Netflix. If he wants to talk to the family, he can call them. So this is an important thing. And other thing is, take care of emotional health of your household members, including yourself. Of course, don't panic. This is a new condition for the whole world, so don't panic. It's not a stigma, please. COVID-19 is not a stigma. It's a pandemic. It's a disease which is in the whole world. So it's not a pandemic. So it's not a stigma to stay home. Please stay home. Quarantine the symptomatic as well as non-symptomatic positive patients, as well as the ones in direct contact with the cases and carriers. Okay, so stay positive. Don't forget hand hygiene. Wash for 20 seconds with soap and water with the alcohol-based sanitizer or alcohol-based anything. Okay, now it is for the doctors, also for any and everyone, that how can we wash our hands. You have to use 60% alcohol as compared to the alcohol which you are using for the surfaces, which is 70% alcohol. So you have to use 60% of alcohol for sanitizer for your hand washing. You have to rub your fingers, palm to palm, thumbs and fingernails as well, because they contain a lot of. What else? You have to wash the wrists. You have to wash the thumb separately, then rub until it is dry, and once it is dry only then it is disinfected. If you are using a hand sanitizer and you are touching the surfaces just in a 10 second or within a few seconds, and your hand is still wet with the sanitizer, please keep it in mind, you are not disinfected. You have not disinfected your hand unless it is dry. So let it dry. Don't hurry. Okay, so personal protective equipment is, everybody knows that. I just added this slide just to make sure that you have to wear a lab coat or apron. You have to wear a surgical mask or a respirator mask depending on which situation you are in, and an eye protection or goggles, and safety gloves, which can be non-sterile gloves as well. Thank you so much. I hope this helps you all in prevention of COVID-19 and knowing more about transmission of COVID-19. Thank you very much. Do not forget to subscribe and press the bell icon and share this video. Thank you. Bye-bye.